Making changes to clinical services within a hospital can be daunting. In 2014, Greensboro Radiology replaced a small radiology group as part of a hospital merger. Here is what the key stakeholders are saying 6 months later.
Well, I think my biggest concerns with the transition was maintaining the level of service that we've had in this community. As a community hospital, we're here to provide the services that are needed in Alamance County. And that's how we plan about the population we serve and exactly what needs to be done. And we've always prided ourselves on having excellent radiology care.
A lot of our concerns had to do with the radiologists, not knowing them. We had been with the same radiologists for, seemed like forever.
We've been an entity that really prides itself on providing something that you wouldn't typically expect to see in a community hospital. And we wanted to make sure that at minimum, we stayed there.
One of the things that I think we do at Greensboro Radiology is we've really worked hard towards bringing a new or very progressive delivery system of radiology to the facilities that we work with. And one of the ways we do this is by breaking down all the barriers to communication in either direction.
We've had some very, very good relationships with our radiologists here at Alamance over the years, but with the introduction of the Greensboro group, it brings to us a lot more subspecialized experts who can provide additional services for our patients. In addition, now they're here 24/7, so we can offer round-the-clock services that we could not provide in the past.
And we immediately recognized that just the way they handle themselves and the way they take care of the patients, that this was going to be a great relationship moving forward.
The breast specialists, the dedicated mammographers, are able to define something on a screening mammogram and proceed directly to additional studies or a core needle biopsy that gives us an answer in a matter of days instead of weeks.
People were very excited to hear that they can provide so many more services compared to what we had it in the past. Now we put the orders and things get done. It's very quick and efficient.
They came right in, they sat down with the patients, each patient, after their exam, explained it to them, talked to them about it. It was great. That was the biggest, we were like, okay, this is gonna work.
Now that we work with a much larger group that has an extremely well-developed force of highly qualified and trained individuals, we don't have to worry about that consistency piece. We know that because of our relationship, we can always depend on the presence and availability of subspecialized radiologists. And that really enables us to offer tremendous care to our community.
Greensboro Radiology.